Good day, team. How are you? I hope everything's fine, family's fine, and everything, all of you is in good health condition. Today, I will be presenting to you a very brief presentation about the ongoing pandemic that we are into right now. So it's all about COVID-19. So let me just share with you the PowerPoint presentation that I have prepared, and we will go through those slides as we go through this process. Ultimately, the objective of this presentation is to give you a different view of what does COVID-19 means in terms of in the health and safety, occupational health and safety aspects. So let me share with you my presentation. Okay, so I hope it's clear now. Let's do the presentation. Yeah. So here we go. So coronavirus, COVID-19. So understanding the hierarchy of control. So first, we need to understand what is coronavirus. So basically, coronavirus is a large family of viruses. Okay, it causes illness to animals and also to humans. It's a known cause to respiratory infections to humans. When we are exposed to this virus, technically the effect to us in our body or the effect of it to our body is respiratory illnesses. So there are other viruses that are related to coronavirus family, and these are MERS and SARS, where MERS is a Middle East respiratory syndrome and SARS is a severe acute respiratory syndrome. These are both coronaviruses, or they belong to the coronaviruses family. What is COVID-19? Well, this COVID-19 is a newly discovered coronavirus. Okay? It's an infectious disease. It's unknown until the outbreak in China in December 2019. So that's where the COVID-19 comes from. So what are the symptoms of COVID? I know that you already know this, but the most common, according to WHO or World Health Organization, the most common symptoms of COVID is fever, tiredness, and dry cough. So this is the most common. Now, for some patients, there are other symptoms that manifest. So that includes aches and pains, nasal congestion, runny nose, sore throat, or diarrhea. Usually, the symptoms starts from mild and begin gradually increasing over a period of time, or what they call this incubation period. So those are the symptoms. So now we are going to attack this topic on the context of occupational health and safety. Okay, so let's go back to the occupational health and safety settings. So there are four terminologies that I would like you to be refreshed of. The first one is hazard, wherein we define hazard as anything who has the potential to cause harm, or anything that has the potential to cause harm is a hazard. And for this hazard to cause harm, you need an event, or what we call a hazardous event. And then this hazardous event is dependent whether what are the chances that it will happen, or what we call likelihood. And then when it happens, what would be the consequence of that event? Okay, so these are the four basic terms in occupational health and safety. Again, let me repeat it. Hazard is anything that has the potential to cause harm. And for that harm to happen, you need a hazardous event. Okay, but the hazardous event is dependent on the likelihood or the chances of it happening. And eventually, when it happens, the consequence of that event is what we call, the outcome of that hazardous event is what we call consequence. So we will try to make that analogy into this context of COVID-19. So in COVID-19, as per my analogy or as per my understanding, when we define hazard, the hazard here is the virus itself, or the person who has been infected with the virus is a hazard in itself. Why he becomes a hazard, or the infected person is a hazard? It's because he what? Begins the transmission of viruses through his droplets from saliva or discharges from the nose when an infected person coughs or sneezes. That's why that infected person is the hazard in this discussion or in this occasion. So when we talk about hazard, we talk about hazardous event. So what would be the hazardous event? The hazardous event, obviously, when we inhale this droplets into our system. Now, there are only three ways that these viruses enters into our system. And once it enters in our system, that's what we call hazardous event. Okay? So it enters through our eyes, it enters through our nose, it enters through our mouth. And that can be in the form of inhalation, that can be in the form of ingestion, or if when we touch surfaces, if the contaminated surface or the virus is being transferred to our hands, and this is what we call the absorption. And then when we touch our face, we transmit the virus into our system. That's the hazardous event. Now let's go to likelihood. This is the chance of the event, of hazardous event to happen. So when we go to the hospitals, wherein we know for a fact now that there have been influx or there have been numerous cases reported nowadays. So when you go to the hospital, the chance for you to be exposed with the virus increases. Okay, so that's likelihood. Another is when you go to areas where the disease is spreading. Okay, so the chance for you gets higher. Or what is the other chance? When you get to interact with an infected person. This is the danger because sometimes the infected person will manifest symptoms, sometimes it does not. So that's the danger here. And of course, another way for us to be exposed with the virus, I've mentioned this earlier, is through touching contaminated surfaces or objects or things that we get to use day to day in our offices, when we go to the marketplace, or when we go to public places. So these are the areas where the chance of acquiring the virus would be likely. So that's likelihood. Now, when there is an exposure, okay, there is our response, the body's response when once exposed is what we call the consequence. What is the end result or what is the outcome of that hazardous event of being exposed to the hazard? So the outcome would probably from mild to moderate respiratory illness without any administering special treatment as mentioned in the previous slide, or it can also lead to serious illness or even death. We know it's a fact that there have been multiple deaths reported. Okay. Now it's a case-to-case basis because the consequence differs from age group, and of course it differs from the current health condition of a person. That's why the old people and the people with um, health, existing health medical conditions are most vulnerable when being exposed to the virus. Okay, because their immune system is already low. So when they're exposed with the virus attacks the immune systems. So they become more vulnerable in this condition. That's why we shield this group of people from being exposed to the virus. Okay. Now, in health and safety, we normally use the hierarchy of controls to address hazards in our workplace. In this presentation, let's try to go that approach. Okay. So the hierarchy of controls has 5: elimination, substitution, engineering controls, administrative controls, and PPE. Wherein the elimination is the most effective and the least effective is the PPE. So basically this hierarchy of control is just the inverted pyramid. Okay, so we will discuss this one by one. So when we talk about hierarchy of controls elimination, it means physically remove the hazard. Now, in this case of the virus, it's unknown. We don't know how to physically remove the virus in our environment because viruses or virus is everywhere actually. Now, what I can think of only is to probably stop the origin where this virus came from. Now, there's a suspected origin that it came from bats or snakes. But when you go to the World Health Organization, they have not concluded that these are the sources or this came from these animals. Okay. So having said that, although we are not eating bats and snakes here in Saudi Arabia, but what I can think of right now is not disturbing or not considering these bats and snakes as as part of the food, no, by human beings. So basically, this is common in China. So elimination is out of this context. The second hierarchy of control is substitution, wherein we replace the hazard. Now, in the case of virus, um, how can we substitute the virus is through vaccination. Okay, vaccination of similar strain in order for our body to develop immunity. But the reality is, right now, there is no vaccine that have been developed so far. Although there have been numerous claims, or not claims, but there have been numerous tests that is ongoing right now of a type of vaccine that would address this virus. But up until now, there is no conclusive or a conclusion that this is the most effective vaccine for time being. Okay. So that's the context. So let's forget elimination and substitution on this area. Let's go to the next hierarchy of control, the engineering control, meaning isolate people from the hazard. Okay. But in this context, we will only be using this engineering control for people who are studying the behavior of the virus inside a laboratory, wherein they use a shield, okay, as you can see in the presentation or in your screen. They use a shield, a box, to ensure that the virus does not come out and does not expose the people who are studying them. Okay. I know that when you think of engineering controls, what comes into your mind probably is an uh, ventilation system, a guarding system. These are all part of engineering controls. But in this aspect of virus right now, we could not think of an engineering control that would control or that will control the virus for time being. So now we are down to two controls that we see are very important, that we see are very reliable, especially that these have been encouraged by medical practitioners. Okay. So the next control in the hierarchy, which is the fourth one, is administrative controls. In the context of a workplace, this is changing the way people work. But in virus, we are going to say that we are changing the way people might be exposed to the virus. Okay, so remember, the hazardous event of being exposed of the hazard or to the virus is only through our eyes, getting inside our eyes, getting to our nose by inhaling it and getting into our mouth. Okay. So the first recommendation under the administrative controls is good hygiene or hand washing. That's why medical practitioners have advised us to perform this hand washing activity. Okay. So you have to make sure that your hands are thoroughly washed, and they even recommended for at least 20 seconds of doing that. Or some people saying singing happy birthday song 3 times. So that's an equivalent of good hygiene hand washing. Okay, so to eliminate or to remove the viruses that we what had absorbed in our hands on contaminated surfaces. That's why also we prohibit the actions of handshaking. Another control of administrative is social distancing, avoiding close contact with people. Now, what I will say here is that if you are a person, okay, having symptoms related to COVID, like coughing, or you have cough, or you have colds, or you have flu, then the social distancing should begin with you. Okay? So you have to make it your effort not to allow any people to get near to you. Okay? So if you also a healthy person not having this kind of symptoms, you have also to maintain that kind of distance to each other, because we don't know, as I mentioned earlier, that some infected persons will not manifest any symptoms at all. Okay, so it depends from person to person. But one way of minimizing the risk of being exposed to the virus is by having social distancing. Another administrative control that have been recommended is avoid touching our eyes, avoid touching our nose, and avoid touching our mouth. But we know as humans, we love and unconsciously, we get to touch our face a lot of times in a day. So let's make it a habit. Let's be conscious enough to ensure that we don't touch our faces or we don't touch our face without what? Cleaning first our hands. Okay, so again, go back to the first one, hand washing. Of course, another administrative control that they are recommending is to practice good respiratory hygiene. What do we mean by that? We mean by if you are coughing, cover your mouth or your nose if you are sneezing, okay? Or use your um, what is this? Long sleeves, no, to cover it. If you don't have handkerchief, if you have, if you don't have tissues, so use this as a covering mechanism to ensure that you don't spread the droplets to each other or to other people. This is practice good respiratory hygiene. And of course, if you use your hand to cover when sneezing or when coughing, immediately wash your hands so that when you touch surfaces, you will not contaminate these surfaces surrounding you. If you're using a tissue, immediately dispose this tissue into the dustbin and request for removing these tissues afterwards with our housekeepers. Last but not the least is self-isolation. Okay, we always say this to everyone, or it's part of our communication sent by our human resource department that if you are sick, if you are not feeling well, especially if you have symptoms related to this virus, stay home or stay at home. Don't come to work. Okay, because in this way we are minimizing the spread of virus to others. Okay. So this is one aspect also that the government now is implementing quarantine. That the reason behind is to what? To minimize the chances of everyone being exposed to the virus. That's why they're saying if you go out, make sure that you what? Purchase whatever is required. And as much as possible, do it in once in 2 weeks or once a week basis for food replenishment because in this way you minimize your exposure from the virus. Okay, so the last hierarchy of control that we gotta talk about is PPE. Well, obviously PPE means personal protective equipment, so this is to protect the workers or the people who are handling infected persons from being exposed to the virus. Okay? Having said this, the use of mask is only encouraged if you are dealing with sick people or if you are sick yourself so that you don't spread the virus. Okay? The use of face shield is only recommended for health professionals in hospital settings when they are taking care of the infected persons or the patients. They have to make sure that they not only wear the mask but also a face shield on top of the mask because as we said earlier or as I've said earlier, protect that you get to what? To touch your eyes, protect that you need not inhale uh, droplets or you don't inhale air from people who are coughing nearby. So that's the ultimate goal of that. And last but not the least, that the common gloves that we normally see nowadays is hand gloves. Now again, these gloves are only used or recommended for health and safety, for health professionals or medical professionals who are attending sick people. Or if you have a family member who is sick, this can be used. But if it's not, then the use of hand gloves is not recommended. But rather, what is recommended again is to always wash your hands. And always bear in mind not to touch your face without washing your hands or without using hand sanitizers or alcohol based sanitizers. Okay, so I hope that that message is very clear. So reducing the risk or reducing the exposure for both administrative and PPE controls, it minimizes the chance of getting infected. Okay. See, the hierarchy of controls, the most effective down to the least effective, we are only given, or we only have two options out of those five hierarchies, and that is administrative control and PPE. Okay, so if we implement those administrative controls alone, the chance for us to be exposed with the virus is already less. Okay, so that's what we are talking about, or that's what we mean by likelihood or the chance of being exposed. To minimize the consequence of infection to us, there's only one thing that we need to do, and that is to boost our immune system, because our immune system is the only mechanism that fights back the virus that enters into our body. So we have to boost it. How do we do that? By doing daily exercise. Okay, you need to do some running, you need to do some jumping jacks or skipping ropes or whatever exercise to keep your level of oxygen in your body high, to keep your blood flowing. So that's what you need. Eat nutritious food. Okay, that's another thing. Drink vitamins and always hydrate yourself to make your immune to boost your immune system. And last but not the least, the most important or one of the most important aspect of boosting our immune system is having enough rest. When we say having enough rest, meaning having enough sleep during nighttime or at nighttime. Okay. Doctors recommend that for adults, at least we get to have 6 to 8 hours of rest. So I hope that the message is clear, and I hope that this presentation has given you a different insight or understanding of what are these uh, control measures that the government is trying to implement or is advising us to do. Okay, so I hope that the message is clear, and I hope that you were able to learn something out from this presentation. So have a safe day, and thank you for listening to this presentation.